Georgina Kyriakoudes. I'm CEO and co-founder of Aria Health, which is a blockchain-based healthcare data platform. So 5 years ago, I was studying my master's in blockchain, and I was working with a friend of mine, deciding and understanding different topics and what we should do our thesis on, when his wife was rushed into hospital. She was in agonizing pain, didn't know what was wrong with her, and they were frantically rushing around trying to find her medical information. They needed to know, did she have allergies, had she had a past surgery? And she ended up waiting in the hospital for over 3 hours until by chance a doctor that knew her came by, knew her history, rushed her through for an ultrasound. They found she had an ectopic pregnancy and was bleeding internally. And despite the fact that she had given birth in that hospital 2 years beforehand, they didn't even have the details of her gynecologist on file, so they literally had to call him himself. He came in, took her straight through to surgery. She had lost 3 liters of blood, but thankfully managed to save her, and she even had a healthy pregnancy the next year. But this got us thinking, we have access to so much information, but not to our most important data, our health data. And then at the same time, we're studying this technology, which is all about giving data sovereignty back to people, giving the owner access over their information in an extremely and never seen before secure and robust system that gives integrity to information and access management. Now, over those years, we were studying, we released our research, it was published in The Lancet, we spoke with governments, doctors, healthcare providers, and then we saw a massive change happening in the industry. We've seen healthcare costs rise, we've seen a decrease in the number of doctors available, we've seen an aging population, and so we really need to change the way that we look at healthcare towards a more preventative health approach. And in fact, preventative healthcare could lead to 11 million lives saved by 2040, contribute 2.3 trillion euros to Europe's GDP, and give an average 65-year-old the quality of life of a 55-year-old. But there are 2 main keys that we need in order to achieve this. One is data-driven insight. So we need data to be able to discover new therapies, to be able to understand which therapies are working, and to be able to identify adverse health conditions earlier. And then we need the patient. We need the patient involved. We need them engaged, and we need them to be proactive in their health. So currently there's a lot of focus on this first part, and we're seeing across Europe a lot of amazing projects which are standardizing data, unifying data, and creating these big central warehouses of information. The idea that we can leverage that for clinical trials to train AI and NLP machines, personalized medicine, population health analysis, and much more. But as we create these central warehouses, we create a new set of problems. Now we've created an extremely attractive target for hackers who want access to this information. You know, medical data is 10 times more valuable than a credit card number on the black market. And we're seeing that the industry, the healthcare data industry, is actually the fastest growing and most valuable data economy there is. Now think about that. Our number one asset in most companies is now data. Healthcare, that's even more true, and yet we're probably one of the worst industries for actually using it. Now, at the same time, and I don't think by coincidence, it's industry which is also subject to the most data breaches and has the most hacks, and we've seen that in national health systems and at private levels. So we really need to think about, if we want to start leveraging this data, sharing it more, opening the access, the level of security and robustness of our system needs to be much stronger than what we're trying to look at now. Now, on the other hand, with these centralized warehouses, we're now putting one party in control, single entities in control of this data. And that brings a lot of new risks, and the response to that is the regulators are coming in and putting more and more requirements onto these entities to make sure that they're protecting the interests of the patients. But that just adds more bureaucracy. And this is in response to patients starting to feel less trust towards the industry after all these data hacks that we've heard of, and now a lot of stories coming out that data is being sold without the patient's engagement. The NHS UK last year opened up its 55 million patient records for any private business to access without needing the patients even to opt into that. And in fact, immediately 3 million patients opted out of that, but most people don't even know. And so this is just adding to the disempowerment of the patient and leading to them really losing interest in being involved in their healthcare. And that's exactly the opposite of what we want to achieve. And this is where Web3 technology is very apt to be designed. It is a technology that's all about aligning the interests of all the stakeholders. So it's not just about giving the data to the patients. It's about saying what are the interests of all the different stakeholders and how can we incentivize all of us to act in the way that we need. So to open up our health data, to take more proactive care. So we've been working on this for the last 4 years, and I'm going to skip straight forward into showing you how we've implemented this in 2 hospitals within Europe. We have more than 6,000 records on there now, a good few hundred patients using this. So patients can come and they can download our app, and that creates their blockchain wallet. So they're now creating their private space where they can store their own medical records, and they can take their key, which is their digital signature, to prove that they can access it. They can then log into our application and they can request their medical data from their hospitals. All they need to do is send them a connection request. Their hospitals receive this. They go into their existing information system or electronic medical record system, enter the ID of the patient from the app, and we can create a link between the hospital system and the blockchain system where the records are then, all the historical records are immediately transferred into the patient's wallet, and any new record when it's approved also goes in there. Now we achieved this in a machine readable format, so we can also make the information a little bit more engaging, a little bit more understandable. And then we give them the facilities to share this data. So they can share, they can select doctors to share to, they can select which records they want to share to, and they now have full transparency. This is all tracked by the blockchain. And they have full transparency over who has access to which records. They can revoke access and control it as they want. Now, the next level that we're working on in Europe, so we're working with some pharmaceutical and healthcare, further health organizations across Europe and the Middle East. And we're now looking at how could this implement the influence the pharmaceutical and the clinical research organization. So it's great, we've now got to the point where patients have the data, they can control the data. What can it be used for? So one, now the pharmas can come and they can search for data, they can find the patient, and they now have an immediate access to get consent to that patient, to get the consent to get access to that data. Now, before they used to need to be going to the hospitals, going to the doctors contacting the patient's individual consents, trying to explain to them. We now have a peer-to-peer tool where we can immediately get access to them. Second, we're creating longitudinal data. So patients are now able to connect their data sources from multiple different places, have their full lifetime history in their private wallet. So we achieve the same that we do in a centralized system, but without it being centralized. And then patients have a pseudonymous link, their blockchain wallet address, which links all those different data points. So they can now share that data in an anonymous way, and farmers can actually get a full lifetime history of a patient, but keep it anonymous. And this is something that we've spoken to a lot of guys that are now trying to tokenize the data and struggling to say, okay, I've got 2 pieces of data from 2 systems. It's anonymous. How do I know they're from the same patient? So we solve that problem. And then we create a really unique relationship between the pharma, or in future it could be insurance companies, where now they can have direct communications with them. So for example, they can send requests for lifestyle information or to be joining new clinical trials. And we create this openness and transparency between the organization. The final part actually is that also where there's a monetary value to this, we are utilizing smart contracts to distribute that payment across to all the people that are part of the system. So that means the patient gets paid rather than just the healthcare organization, but also the hospital, and if we have data aggregators or people that clean the data, we can make sure that every single person has the same incentive. Everyone wants this data to be sold and everyone gets the same benefit, so we align that. So ultimately, what we're achieving here is we're achieving transparency. Now there's that chain of custody of where is the data, what's happening to it, and we can clearly link that, and the patient can see that in a very clear and easy way. We're bringing collaboration because we're really trying to align all the different interests of the stakeholders. It's the patient needs to be at the center, but we have to consider all the different key players in this industry. And finally, we're bringing fairness through that distribution of that payment, and where there is value in that data, everyone can have their equal and fair right to that. So yes, thank you very much. Yeah, happy to speak to anyone afterwards.